I thought today we could talk about rapid palatal expanders, and there's a common misconception that usually 4 turns equals to 1 millimeters of expansion in a rapid palatal expander screw, which actually not the case in many cases. Now, first of all, when you talk about turns, you're oftentimes talking about quarter turns. So when a patient turns the screw, it's just front to back, and that we count that as a turn, which is oftentimes more like a quarter turn. But the biggest issue is that many doctors think that 4 quarter turns equals 1 millimeter with all palatal expanders, and yet there are many different expander screws available on the market. So it really depends what kind of screws your lab uses. So if you don't specify it and you don't find out what the lab might have used, you could have a problem of under or over expanding. So first of all, there's a couple of things we need to kind of establish. One turn is not a 360-degree turn. It's more like a quarter turn, just front to back. And then second, I encourage you to talk to your lab and find out what screw they use. Is it 5 turns to a millimeter, or 4 quarter turns to a millimeter, or what is it? Because if you're thinking that it's let's just make it easy. You need 10 millimeters of expansion, and if you're using a 4 quarter turn screw, of course it's going to take 40 quarter turns to get 10 millimeters of expansion. But if the lab is using a screw that it takes 5 quarter turns to a millimeter, then you would be under expanding if you're thinking you have a quarter turn, 4 turns per millimeter screw. So it's very important to find out from your lab what palatal expander screw they use, so you can establish the correct number of activations that the lab will need to do. The patient will need to do. Now, the other problem is if you happen to underexpand. Overexpansion is a little bit easier to correct than underexpansion. If you overexpanded, you can either turn it back, or if you remove the expanders, a lot of times it will relapse unless you're grossly overexpanded. But if you're underexpanded, that's quite bad because now you have to either put the expander back, which oftentimes is not possible. For example, with the acrylic expanders, those get pretty much destroyed when you remove them. And even the regular bended expander is a lot of times hard to remove without bending it or destroying it. So now you have to make a new expander if you're underexpanded. And in the meantime, the teeth will change some. So when you send it to the lab and then you get the new expander back from the lab, it may not even fit. And you'd be thinking maybe the lab didn't fabricate it correctly, but oftentimes the teeth have shifted after removing the expander. So it could be quite a challenge to correct under expansion. So it's very important to figure out what kind of expander screw you have. You count the number of turns that corresponds to the amount of expansions that you're trying to get. And then you make sure that the patient actually activated the screws correctly. The other problem is a lot of times the patients think it's like a ratchet. So it's not like they do like a front to back and front activation, like almost like a ratchet. And these expander screws are not like a ratchet, so one activation is just front to back, that's it. And you have to remove the turning key. Otherwise, if you turn the screw back, of course, nothing's happening, and that can happen. I've seen that. So I encourage you to talk to your lab and get specific information that the screws that they have used for your expander, and then you figure out the number of turns, and then you won't have the problem of under or over expanding. And if you happen to underexpand, I recommend if you use an acrylic expander, before you cement it, maybe drill a hole over the mesiobuccal cusp in the acrylic, through the acrylic, so you can see, or either drill a hole or just put a mark, like a little dot where the mesiobuccal cusp is, so you can see when you do the expansion to see how much you have expanded, and you can evaluate it, make sure you're not underexpanding. There's also other issues, the screw can be stripped and things like that, but I just don't see that very often. I think I maybe had one case over the years that the screw was stripped, and then you turn it and nothing happens. Sometimes I do ask the lab to activate the screw, so maybe give it like a few turns, so in case, when you solder these expanders and you make the frame, sometimes they shrink, so they can change shape. So if the lab turns the screw a couple of times, one thing that ensures that the screw is not stripped. And the other thing is that you can play a little bit with it in case it doesn't fit quite right. But most of the time I really don't have problems with expanders not seating. But number of turns per millimeter, number of activations per millimeter, that is constantly an issue that I see, that doctors and orthodontists will underexpand or overexpand because of the calculations are not correct. Well, I hope you found this helpful, and if you have any questions, just send us an email, and then I wish you good luck, and hopefully you'll avoid some of these problems with expanders, and then as I said, just communicate with the lab and everything should go quite smoothly. Wish you best of luck. Bye.